And with that, it is 5 o'clock, so I will call our meeting of the Health and Human Services Board for March 17th to order. It's nice to see everyone. I hope things are going well. You've been staying safe. It's been a little frustrating at times, but patience, I think, is paying out for everybody. So we will be moving forward, and I'll call the meeting to order. Colleen, you want to take a roll call, please?
Sure. Kathy Leaf?
Present.
Kara Koch?
Present.
Dave Osnes?
President.
Scotty Ard? Greg
Scotty's excused, Colleen.
Okay, thank you. Greg Telejohn?
Present.
Paulette Anderson?
Present.
Deb Lindeman?
Present.
Natasha Ward?
Present.
Paul McGinnis?
Present.
Thank you.
Thank you. We do have a quorum. We'll take a look at the approval of the minutes from Wednesday, February 17th. Does anyone have any additions or corrections to those minutes? Seeing none, we'll move right into public comment. Ken, you want to get us started, please?
Yep, I have one with their hand raised so far. All right, I have a caller. If you want to unmute and make your comment, I will start the timer.
Good evening, everyone. I'm Hudson, Wisconsin. I just want to thank you for your hard work and call your attention to a couple things. First of all, on the vaccine, I think we're doing a great job. I was wondering if we had an anticipated date of when people on Medicaid were going to go, and then I was going to tell you about Disability Advocacy Day, which is March 23rd. It's going to be virtual this year, and it's a great opportunity for us to tell our legislators what's important to them, and then we have a budget listening session, and if I can, I'll put my public comments here in the chat if I can, so everybody can see it. But the governor also has his Badger Bounce Back plan, and the first session for that is going to be this Thursday from 6 to 7, but Thursday of the 26th or 25th is going to be on healthcare equity. So I would encourage everybody to come. And if that chat is open, I'll put my public comments in the chat. Thank you very much, and hope you all are staying safe.
All right, thank you. You just breached the time limit.
And thank you, Ramsey. It's been a while since you and I have had a good conversation one-on-one, and I'm looking forward to that day very, very soon. So thank you very much.
All right. Are there any others in the chat that want to speak during public comment? Please use the raise hand feature now. I do not have any additional ones, Chair Osnes. I will turn the meeting back over to you.
All right, thank you. move right into our business items with the COVID vaccine update. Ellie.
Thank you very much for having me this evening. If you could give me a moment as I load the presentation. I always have to switch computers as to be able to show you video with the presentation. So please give me one moment. I apologize for the delay. It seems it is still loading. It'll be just one moment more further.
No problem. If you're having trouble right now, do you want us to jump to Lori and then come back to you, Ellie? Would that help you out?
That's great, but actually I just got it to load. So let me go ahead and share my screen and we'll be on our way.
Okay. You're still smiling, that's a good sign.
All right. Thank you all for having me this evening. Again, my name is Ellie Clausen. I am the epidemiologist here for St. Croix County Public Health. Tonight we are doing our COVID-19 vaccine distribution update. What comes along with vaccinations always is there seems to be, well, we'll move forward. So what we're seeing here is just a very quick update on where we stand with our disease activity in St. Croix County. You can see from the stars, we are currently at about 15 cases coming in on a day, which means we land at about where we were back in mid-September. What this bar is actually circulating, which is showing on a different presentation, but will be uploaded in the final presentation that's attached to the agenda, just lets you know that in the DHS distinguishing sections of where we fall in terms of case activity, we still fall at high. So that means that our case rate is enough to where, due to the burden of cases, we fall at a high level. So we are definitely working down that hill, but we have a little ways to go. And to just remember to keep up those standard practices. The other great piece that will help us continue is our vaccination. So what you're seeing here are the vaccine doses administered to St. Croix County residents. This is as of completion yesterday. And as you can see, as we progress, we are able to vaccinate more and more individuals. What you're seeing here is first dose in blue and second dose in yellow. Of these doses so far, this is only including Pfizer and Moderna. Soon we will be having the third vaccine, the Johnson & Johnson. And so once you complete that second dose, then you are, after a certain amount of period, considered fully vaccinated. And looking at the percent of St. Croix County residents vaccinated, first dose, we're at about 19.2%, and completed series, we are at 10.6%, meaning about 10.6 have completely completed those two doses. We're using numbers from a 2019 census, which does mirror what DHS uses for their population for St. Croix County. Just a small note of those vaccinated, we do not have those individuals who were vaccinated at the VA. Those numbers are not entered into our Wisconsin immunization registry, which is where all this data is coming from. At St. Croix County ourselves, our vaccine clinics. I've actually left one today to be here with you. We are continually receiving more and more vaccine in terms of receiving first and second dose. So as of today was our largest clinic, and by the end, which should have just wrapped up, our hope was to vaccinate 522 individuals with both first and second doses vaccinations. Now, if you are still looking to be vaccinated and how you sign up, please head to our website there on the left-hand side, the sccwi.gov, and there is a link to how to get vaccinated, and you can go ahead and press on the request a vaccine, fill out a form as completely as you can. You will not get an email notification that you have completed, but know that we have your information and we will contact you as soon as you are eligible. So who is eligible? Currently, this is the list provided by the Department of Health Services at Wisconsin, the DHS, and this is a list in terms of priority. So the top of the list are going to be vaccinated first, and as soon as we complete, we will be moving down that list. So as you can see, more and more individuals have been added to the list, meaning more and more individuals are eligible. However, being eligible doesn't necessarily mean that we have vaccine for you today. It means that as soon as we reach your group, you will be called in and we will get you vaccinated. Either they're here at our clinics with St. Croix County Public Health or at one of the surrounding hospitals or vaccine providers in the area. Beginning March 22nd, individuals age 16 and older with certain medical conditions will be eligible. So if you have any questions about where you fall in eligibility, DHS has a full description of each group to see if you fall within it, and that can be found at dhs.wisconsin.gov/COVID vaccine about.htm. This link will also be on the slides included the agenda, so it can be accessed there as well. Okay. Now, what does it mean once you are vaccinated? So of those who are fully vaccinated, who are not in a healthcare setting, so this applies to the general population, those who are not in long-term healthcare or in a hospital setting, in a non-healthcare setting. So fully vaccinated means 2 weeks since the last dose of your series. So last dose, if you are having Pfizer or Moderna, those are 2 doses. So you're going to have to wait 2 weeks after the second dose. So in this example, the second dose happened on the 1st. You would wait the full 2 weeks, and then on the 16th, you are considered fully vaccinated. Once Johnson & Johnson comes out, that is just a 1 dose to be considered fully vaccinated. So you'll have your 1 dose, wait the complete 2 weeks, and then you'll be considered fully vaccinated. What does that mean to be fully vaccinated? To be fully vaccinated, it means that in a private setting, you can gather with other individuals who are fully vaccinated indoors without wearing masks or physical distancing. Now, these individuals must also be fully vaccinated. They must be 2 weeks post the last dose in their series. Now, in a private setting, you may also visit with unvaccinated people from a single household that are at a low risk for severe COVID disease. Indoors without wearing masks or physical distancing. And those individuals do not have to quarantine or test following a known exposure to COVID-19 if they don't have symptoms. If you are fully vaccinated and you have COVID-like symptoms, we recommend you go in for testing and stay home until you get those results. The other piece to those, so we talked about private settings, right? Now in the public and around other unvaccinated individuals, we ask that you maintain those standard precautions. So in public, you wear the mask, still practice physical distancing, and do your best to avoid coming into the close contact. So still avoiding those large gatherings, testing if you have symptoms, and then obviously following travel employer guidance and recommendations. Okay, so that is what I have for today. Thank you very much.
Thank you, Ellie. Are there any questions for Ellie? Comment, Deb, go Go ahead.
Ellie, are the vaccination rates for St. Croix County residents similar to the other counties in the state? Do you know?
We are approximately similar. DHS does provide a great map that shows vaccination rates. In our immediate proximity, we are close to Polk and Pierce County. There are some counties in the north, such as Ashland, that have really great rates. But we are keeping up, and we do expect, as heard from DHS, that very quickly will our vaccine supply be enough to meet the demand.
Anyone else? Greg? Go ahead, Greg.
Yeah, what is our supply looking at this week and next week? Are we getting how many per order, or what do we do? How's it going?
We are still not getting what we have requested from the state, but those amounts have been increasing, and so we are continually moving in the direction we hope to be going.
Dr. McGinnis, you had a question?
Yeah, a question and then a comment. Ellie, do you have information on what percentage of our St. Croix County's over 65 residents have been vaccinated so far? I
do, Dr. McGinnis. Unfortunately, which is that Wisconsin registry. I thank you for bringing that up. It has been overloaded today with all the vaccine clinics today, so I actually couldn't pull specific data for today. But as of the 11th, the March 11th, we had given a first dose to 64% of our 65 plus, and completed series, we had 30%. And knowing that is a bit of an underestimate, as we don't have those individuals who were vaccinated at the VA.
Right. Okay.
And I would just like to say, I was clicking through that presentation, but I think a great piece to add to my presentation is, if Dr. McGinnis, if you would have anything to add on for those individuals who are fully vaccinated from a medical standpoint, that would be great.
I think basically covered the fully vaccinated individuals very, very well. I think the important thing for the members of the county to remember is that if you're unvaccinated, you're still in that risk group that can catch it, that can spread it. And that's what we really want to try and get those case numbers, still keep those going down. Kind of stalled out here in the last 3 weeks. And I think that's why we're hearing the importance of that, continuing to mask, continuing to social distance, all of those kinds of things. So regrettably, the pandemic may not be done with us. We don't know. And that's the hard part, is we just don't know. But I think that most everyone would agree it's far too early to start celebrating the end of the race. We haven't reached the finish line yet. So you can't stop running. You can't stop playing till the game, till the run, till the marathon is over. And I think that's the important thing. And in that case, that means the masking, the distancing, the hand washing, and really trying to limit those gatherings that we all so desperately want to get back to. So I think that's the important message.
And we thank you for that, Dr. McGinnis. Anyone else? Ellie, I'd just like you and staff to know, last Wednesday, I happened to be at WITC later in the afternoon, and my 81-year-old neighbor came running down the sidewalk to me, and she said, "I'd give you a big hug because I finally got my first shot, but we can do the funky chicken now." And she said, everybody, she said, the staff from the time I walked in there until I left, she said, those people make me so at ease, and everybody else. So I wanted to pass that on to you guys. You're doing a great job. Thank you.
Thank you for sharing that. That's great.
Okay, anybody else? Okay, we're going to move on. Thank you again, Ellie.
Thank you all. Have a great night.
Yep. We're going to move on to our public health permit fee schedule. Lori, are you on?
Yes, I'm here.
Okay, the floor is yours.
All right. Good evening, everybody. If you remember, at last month's meeting, I gave a brief presentation about the environmental health program. And one of the program areas within environmental health is our licensing and inspections. And we have 3 agent contracts, 2 with DSPS, Department of Safety and Professional Services, and 1 with Department of Agriculture, Trade and Consumer Protection. And that's where we're licensing and inspecting. I looked in our database. As of today, we have 558 facilities that we license in the county. And what we do each year is we evaluate the fee structure for the permits, for the annual permits, the pre-inspection fees, the re-inspection fees, and then we have a category called other fees. And what you have before you are the fees, first of all, for the annual permits. And what we do each year is we evaluate whether or not, based on our program costs, if we need to do any fee increases. This year, for our license year is a little bit different. It runs from July 1st of each year through June 30th of each year. It's not the calendar year. But we made the decision that we're not going to make any across-the-board fee increases this year, to be sensitive to what's going on with COVID and to our businesses in the community. Although we have made some adjustments to the fee schedule, and those are the items that are in yellow. And we had to do that because ATCP 75, which is the food code for the Department of Agriculture contract, was adjusted and changed this year. So agents have to make similar adjustments in their fee schedule to reflect what happened on the state level. Within the changes in the ATCP 75 this year that impact the fee schedule and the businesses and what license categories they will be in, is the assessment changed. So as you probably noticed, there's a lot of different license categories. Specifically for ATCP, just as for food facilities, so it's restaurants, retail food establishments, that's gas stations, bakeries, delis, grocery stores, etc. When we go and do a routine inspection each year, we complete what's called the assessment. And that assessment is for food facilities now. For restaurants, it's a 12-item checklist. And for retail food establishments, it's an 18-point checklist. And that's what determines, based on their complexity of their menu, the types of foods they handle, the dollar volumes of sales that they have each year. It determines what license category that they will be in. When a facility, when we complete the assessment, the operator is given advance notice if the fee or if their category will change, because we go through that with them when we're doing the routine inspection. So for tonight, what we're looking at in the fee schedule for changes are some of the license categories, the names of the categories changed. There was some merging of categories. There were 4 license types that were merged into 2 categories. And there was 1 new license category. In addition, we did some alignment of the reinspection fees so that they would align with the restaurant and the retail food establishment fees would align. We also did some alignment of the pre-inspection fees for those, both the restaurants and retail food establishments. We also made a small adjustment in the license fee for micro markets because the ATCP 75 tells us exactly how much we can charge. We can charge what the state charges plus 10%. So that license fee, I think, went down just a couple of dollars For 21, it went down, I don't know, $1 or $2. I'd have to pull it up. It's not on the screen that's right in front of us right now. But, and then in the cases where the categories, there were the 4 categories that merged into 2, there would have been 4 different fee amounts, and we needed to select a single amount for each of those 2 that were merged. With these changes, keep in mind that they will go into effect because our license, the new license year, when we send the renewals out in May, they'll go into effect July 1st. But they really only go into effect for facilities that will be newly licensed. Existing facilities, when we go to do their routine inspection, as I said, we will do an assessment of their license fee. And if they change in license category and it is a fiscal impact for them, they will not be, that new fee amount will not be charged until May of 2022. So if there are some facilities that move into a category where there was a increase in fee, existing facilities won't see that until May of 2022, and they will have advance notice of that. Let's see, new facilities, yeah. A couple other things, you know, because these assessments changed along with the license fee categories, our team did a prediction, if you will, of how we feel this will impact businesses. And we're estimating that there'll be about 14 facilities that their license fee will go down about $71 a year. And there's about a little over 10 facilities that we predict that will go up close to $100 a year. We also, in the ATCP 75, there was a change in who licenses transient food facilities, which are temporary restaurants that are at special events. And due to the change in the state code, we predict we'll be licensing more of those, because instead of the state licensing them, St. Croix County will license those that operate in counties in addition to just St. Croix County. Previously, we would have only licensed those temporary food stands if they only operated in St. Croix County. Now we'll license them, and other jurisdictions will accept our license if they operate in additional areas. So assuming that there's more temporary events this year and, you know, life goes back to normal, we're predicting that we'll have an increase in our revenue based on those licensing those additional food stands. I know it's a lot to look at, and I debated whether or not I should put a you know, like a verbal explanation or a written explanation like I described right now of what you see before you, but I thought it might be more confusing. So if you guys have questions, please feel free to ask.
Lori,
Yes.
I spoke with you earlier, and I'm glad to see we don't have potential hazardous food.
Yeah. Yeah. Greg asked me, he said, what is this potentially hazardous food facilities that we're licensing? Why do we license foods that are going to sell foods that are hazardous? And the term potentially hazardous, basically what it means is they are foods that require refrigeration for safety. And that is one of the terms in the license category names that has been eliminated. So right before you right now, you can see in that little purple color where it says large potentially hazardous, small potentially hazardous. If you look to the middle column where it's in yellow, you don't see that anymore. Any questions?
Lori, I did have a question.
Yeah.
Was there any conversation that you're aware of related to the fact that, this particular group of businesses that are being licensed, a lot of them have had a really rough year with COVID. Was there any conversation at the county level or in your area about possibly forbearing fees for a year just to give them a little extra help? I mean, it's not a lot of money, $500 a piece, but it does add up over time. And so I was wondering if there was any conversation around that.
Well, we're required to license them by state statute. They're required to be licensed. And so I don't think that we would have any, legally we have to license them, if that's what you're saying.
Well, my assumption is they would still be required to be licensed, but they just would not be charged the fee.
Oh, well, no, I guess, no, we did not consider no fees, but we are not increasing fees across the board.
If I could jump in to Dr. McGinnis's point. So we actually had last year, probably about April, we had talked about business fees and whether due to the pandemic we should hold them. And I don't know if we had spoke with public health directly about that. But it probably is within the prerogative of the public health permit fee schedule right now that's before you. You could technically do that with action this evening because you're setting the fees for 2021 and you could set them at 0 and to restart up in 2022. That does have a fiscal impact that we haven't fully analyzed yet. But I did just want to make you aware that that is an option, technically speaking.
Go ahead, Dr. McGinnis.
I was going to say, would that be something that would be reasonable to take back into the county staff and then come back at the future meeting in April with a recommendation? Or is that going to delay just getting this information out to those that are dependent upon the licensing?
Do you know when you do the billing, Lori, on your licensing?
Yeah, we usually send them out around the 3rd week of May.
So you have time, Dr. McGinnis.
Yeah. Chair Osnes, if it would be reasonable, would it be okay to request that that be reviewed by county staff and returned to the committee with a recommendation at its meeting in April?
I think
the HSS board.
Yeah, we could do that. We can hold off on the recommendation and let's do it next month. Is that possible, Lori, with you?
Yes. Yep. I mean, because we do have that time, May 22nd is, well, it's not May 22nd. Around the 3rd week of May is when we run the renewals. I do believe if we did something like that, there would be some administrative time in going into our database, et cetera, that we would have to, count on that extra time to figure that all out. But
Bob,
sorry, I'm not making your life easier.
well, it's not, it's, it's working in a database, a state database. So
Bob, your any thoughts on this one?
Well, my only thought is that when we were talking about this, we considered, as Lori said, we considered not raising the fees for that reason to help businesses, and it would be probably without analyzing it further, would be a significant impact on our budget, not to take away from the impact that businesses are feeling. But our consideration was around not raising fees in order to, in that way, help businesses.
Dr. McGinnis?
Yeah, I did hear that and I understood that. I was just looking at that, okay, is there a next step and was that discussed and is it worth a conversation, especially because it's been a difficult year for a lot of these businesses.
I have a question.
Go ahead, Deb. And then Kathy, you can follow up.
Okay. I'm just wondering, maybe as part of that, maybe just a inquiry with other agencies, other health departments, if they are considering anything similar. So you kind of see what's going on around the state. And also, that would be a big fiscal impact because you also have to pay money into the state, right, as part of our fees. We don't keep all those fees, correct? Am I right, Lori? I can't remember now, but
Right, yeah, so the fees that we collect, we have to pay a reimbursement back to the state each year.
Okay.
So our reimbursement amount is based on the state's fee schedule, not ours. We have to pay 10% of what the state would charge for each of these licenses back to them. And I believe, I mean, I could throw out some rough numbers, but I don't think that, I think that might be a disservice in case I'm not accurate. But, you know, we pay, it's a chunk of money back to the state each year. So if we charged no fee, we would also, in addition to the loss of revenue for the fees that we would collect, you'd also have to calculate, it would be an additional loss because I'm sure the state would, I mean, they would still require us to pay that reimbursement on amount that we didn't collect. And I can certainly get those numbers for you. Would you want me to give you what I recall or not say an estimate? I'm not sure what, if that would be a disservice.
I think it would be better to work from known information rather than
Just,
trying
yeah,
to remember
yeah. I don't want to give.
as best you can.
Yeah.
So
And Faye is on. I don't know if, I don't want to put her in a position to have to pull something out really quickly, but we can certainly look all of that up and get that information to you.
yeah, I think it would be reasonable to at least get a recommendation or some further information back to the board to assess that and figure out whether that's something that makes sense or whether there's other tools that are better used to support some of those businesses in our county.
Hey, do you want to chime in on that one?
I was just going to say that, yeah, I don't have that information at my fingertips. So, you know, we can definitely do that analysis and come with, you know, a couple different recommendations, even if it's not that we can waive the full fee. Maybe potentially there's a discount that would make sense. So we can do that analysis and bring some information to the board next month to see what they would like to do with it.
Kathy?
I had one quick question, and it's for Administrator Witt. So would this be something that would qualify for the federal money that's coming to the county through the recent stimulus package? Or could it be a consideration set for the board using that?
Yeah. In the budget, just by the way, before I answer Supervisor Leaf's question, Public Health has permits and fees collected just under $200,000 a year. So I don't know if there's other fees in that, Lori, or if that's the bulk of them is what the fee schedule you're talking, but.
This fee schedule is the bulk of them. There is some additional fees we collect for water sampling and so on, and I'm not sure if that's a separate line item on the budget that you're looking at.
Yeah, it's probably not. It's probably included in there.
Okay.
But about 200,000 is the budgeted line item for that. So Supervisor Leaf's question then, the federal stimulus money is able to replace lost revenues. That's subject to county board approval, though, of how that money is going to be allocated, but that is one of the authorized uses.
Bob, do you want to weigh in on anything more?
I guess, Administrator Witt, I would just wonder if we voluntarily waived fees, if that would still be covered by the relief package. And I don't know if that $200,000 roughly would include then the fees we also have to pay or the percentage we have to pay to the state on top of that. So.
It is a self-inflicted lost revenue, but yes.
If I could add just one thing, I'd be a little bit concerned about the time. Maybe this shouldn't be a consideration, but the time it would take our staff to analyze this in depth. We can do that if that's what you want.
Yep, and I know I sort of threw that at you guys, but I did want to make sure that you knew what options were available to you before you did take action on the item. It is an actual viable option under your jurisdiction to take if necessary.
Dr. McGinnis, go ahead.
I'm wondering, is this something that perhaps is better taken up by the county finance committee or county board, whoever is going to work with whatever federal stimulus dollars come in, and use this as possibly one of the tools that could be used, and then this body would not be as directly involved with that?
Ken?
Yeah, well, this body is the one that sets the fees. So it would take probably, action from both parties, the county board on the reimbursement side with federal stimulus money, and from the Health and Human Service Board to establish that fee schedule or the waiver of the fee schedule. The other thing, is probably more beneficial right now for these businesses with the fees. But the federal stimulus money does have a time frame for use through 2024. So even if it wasn't waived for 2021, could you do a reduced fee for 2022 or no fees then? Although, you're hopefully a year past the pandemic by the time we get to this time next year.
Yeah.
So what is the board's recommendation at this point? Do we want to move forward with what we've seen? Do you want to hold off for a month? We got to make a decision. Dr. McGinnis, go ahead.
Yeah, I guess I'll make a motion that we ask staff to take a high-level look at this and bring back a recommendation to the board for next month.
Lori, you're all right with that?
Yeah, I'm all right with it. I would like maybe some guidance as specifically what you'd like to see and an analysis for that so that I can get together the right information. But I don't know that has to be decided right here and now. I could work with Ken or whoever and Bob, to, what data we'd want to bring forward and Faye.
Bob, your thought on it? Do you want to get together and we'll work something out?
Sure. Yes.
All right, let's do that then. Then we'll hold off on the decision and we'll bring it back to the board next month. Everybody okay with that?
Wasn't there a motion?
Yeah, we need a second to a motion and
I'll second it.
Should vote, yeah.
Okay, there's a motion and a second that Lori will bring information back to us for a vote for next month. All in favor, say aye.
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 Is there anyone opposed? Right, seeing none, motion carries. We'll bring her back next month.
Well, then you get to see me 3 months in a row.
Well, Lori, you're fortunate. You get to see us 3 months in a row too.
Yeah.
Remember that.
Yeah. All right. Well, thanks a lot, you guys. I appreciate it. Yep.
You're doing a great job, Lori. Thank you.
Yep. Thank you.
Yep. Okay, we're going to move on to our next monthly financials. Faye.
Okay, here I am. Okay, so good evening, everybody. Still light outside, which is really nice. I hate the time change, but I guess I can smile about the light outside anyways. So within your packet, you had the financials. When I'm looking at February of 21 to February of 2020, you'll notice in our state lines that we still do not have any state revenues in two of our lines. So that's the 43510 and the 43550. That money starts coming in March and April. Right now, we're still posting a lot of money from our state grants back to fiscal year 2020. The next line down, that $182,066, that was our Adrc transportation grant. That one comes in right away at the beginning of the year, and we get the full amount. And then that's just good for the entire year as we spend that money down. If you go down to page 13, so all the way down to the expenses. And I was just going to point out here, our fiscal 20 revenue is 17,053. Last month, that was a negative 472,000. So that's those additional revenues that we keep posting back to 2020. We are expecting some more money from ADRC and some of our other birth to 3 reconciliations, children's long-term support. So there'll be some additional money yet that gets posted back to 2020. There really wasn't anything specific per departments. I think if you, trying to see what page you're on. If you're on public health, let me look at that, 233. If you scroll down a little bit further on the public health line, oh, no, we're already done that. I was going to go up a little bit. Public health, you'll just see right here the wages and fringes when you look at February of this year to February of last year. And that's, again, all that extra staff that we have in helping us with the contact tracing, helping with the vaccination clinics. And we have the grant money that's covering those additional staff who are helping with those services that we need. So then I think we can go all the way down to the health center campus. And that is on page 31. So the report was ran early this month and did not include any of the health center campus revenue. So when you're looking at February of this year to February of last year, that's not included in there. That amount was, is 345,000. So next month that will all catch up and we'll see them back on track. So both Health Center Campus and Orchard View then are currently at a positive balance when that revenue is posted. And then just on the last page that we have Veteran Services, and they are on track. There's not a lot that goes on this early in the season or early in the year. And then we have our purchase services on the last page. And again, we just have this as extra information so the board can see trends in some of our purchase services that are going on. Each of our big departments, so Children's Services, CCS, and Behavioral Health have their own line. So you can see the January expenses, February expenses, and March really aren't showing up yet. We do have nursing home audit is going on right now. And then HHS audit will start in May. Any questions for me?
Any questions? Comments? Concerns?
I do.
Okay, go ahead, Greg.
I don't know if this is appropriate to ask it here or where, but when you said ADRC transportation, remind me of an article I read in the county newspaper about counties providing free transportation to vaccine sites. Do we do anything like that?
I'm not aware specifically. I know we do. Amy arranges transportation for medical appointments for people who work with the ADRC on a regular basis. I don't know specifically what's going on with transportation. I know our ADRC 2 is working with public health and applied for a grant in order to provide vaccines to homebound people that they work with. So that's something that's in process and they're looking at. And that would probably be covered through that grant if they get approved for that, which I think they're very certain they will be.
And
but I
maybe
don't.
maybe you're not the right person to ask, but it reminded me of that article I read, and wondering if we do anything like that, or if we could do anything like that, or if it's appropriate to do something like that.
Greg, I'll tell you what, and with all due respect to you, how about if I get a hold of Brad and Amy within the next couple days? I'll ask them that question, and we'll get back to you right away on that one. Is that fair enough?
That's fine. I know it's not on the agenda, and I probably should have asked it earlier, but anyway.
Oh, that's a good question. I'll work on that one, and I'll get back to you.
Thank you.
You bet. Anyone else have any questions? Seeing none, Faye, thank you very much. You're doing a great job for us, and it is greatly appreciated. Keep up your great work.
Thank you.
You bet. We're going to move on to our final item on our agenda for tonight, and that's a presentation from Mr. Phil, from our Veteran Service Officer. It's nice to see you tonight, sir. I haven't seen you for a whole day or so.
I know, yeah. I haven't seen you for one day, Dave. Good seeing you again. Paulette, I saw you earlier today in a meeting, so now I get to see you via Zoom as well. But thank you again for the opportunity to just kind of give you guys a little bit of a background on what it is that we do in the Veteran Services. For those of you who don't know or are new to the board, basically we're local advocates. We're paid by the county, and our job is to advocate for veterans and their family members for any issues that they may be having. Filing disability claims, pension claims, education. We actually work with some forms of funeral services, memorial programs, and these benefits can be state and federal benefits. A big one is VA healthcare, and one of the things that we do is we transport veterans to and from with the VA healthcare. We have a VA van. It has been in the shop for going on 6 months now, so it's been a challenge, but we have some fantastic and wonderful drivers who are driving their own vehicles over to the Minneapolis VA Medical Center. They're getting reimbursements through our office, and we take them over for COVID shots. That actually costs $0 to the veterans. When we set this program up, we pick them up from the home, transport them to the Minneapolis VA Medical Center, and we return them back. It's door-to-door service, and it doesn't cost them anything. That was one of the things I remember, Dave, that you had brought to the table that you would like to have tried to have accomplished, and we were able to work that into our transportation program as it sits right now. There are issues with the VA van, especially when it's in the shop, but once it does come back online, that will be another real good thing. In St. Croix County, we have about 5,260 veterans comparatively to what the VA data has told us. And of that, I can tell you quite a few of them have been vaccinated. I know this because I've talked to them, and I've also transported quite a few of them over there to get their first and second vaccines. Our drivers, many of them are veterans themselves, were one of the first ones to get vaccinated. Every single day there, they have a line of about 1,400 veterans who are going to be getting vaccinated at least. And I guarantee you that many of them are from St. Croix County, and that would factor in to those numbers that we'd seen earlier as well. So there are more people that have been vaccinated, there's no doubt. We have 3 people who work in our office, and myself and Joe. He is new to the office, although he's been there for 6 months. We work with benefits, and then we have Kathy, and she is the jack of all trades, and she does a fantastic job, and we're very grateful for her, but she does not work with benefits. We get transportation grant, and we also get a CVSO grant. The transportation grant comes from the state as well as the CVSO grant. The transportation grant is on a usage basis. Last year, we got about $3,400 for the transportation. the numbers went significantly down because there were not a lot of people that were going over to the VA because they were trying to do a lot of Skype visits and things like that. But those have picked up pretty significantly. As a matter of fact, I was looking at the numbers already this month. I think that we have 17 trips over there. So every single day, it was a lot of trips. We've taken a lot of trips in March, and we've had multiple riders each time. So the numbers are high. Let me look at my little cheat sheet. Oh, I should have really focused on the numbers because of the 5,260 people and their dependents, if you do the costs of what they bring in financially, whether it be through disability dollars, other things like that, we're talking almost $20 million, $19.7 million are brought back into St. Croix County and spent there. It's a big number. And those people are spending it in the county and locally. So it's a big boon to the economy. So when we do a good job and our veterans have a little bit more money from the federal government, it's going to be spent locally and it's going to help our economy. If you can amortize that out and you get good return on investment from the Veteran Service Office, if I humbly would say so myself. I can't think of anything else. We are in person, although I am home right now. It's because it's after hours, but we are in person and we're seeing veterans face to face, masks on, and I always enjoy talking to our veterans. When we talk to them, we're going to have to work through whatever issues that they may be having. Might be financial, might be substance abuse, might be mental health. And then our job is to get them in with those resources and help them out as much as we can. It might be a claim, it may not, but we try to point them in the right direction. It's a lot of asking questions and things like that. So if you know any veterans that are out there that haven't heard of our office, please, outreach is important. Refer them to our office. We'll do everything that we can to help them out to the best of our ability. So if you guys have any questions, feel free. I'm open.
Phil, do you want to talk just a little bit on how you guys work with the great partnership that you've got with Grape's Place and Westcap?
Yeah, absolutely. So when veterans do come in and they are homeless or on the verge of homelessness, that's a real solid. We're so blessed to have them so close. We're in New Richmond and they're right in New Richmond, and that's my dog. And we'll just I've even drove somebody up there, and I've dropped them off. Well, not dropped them off literally. That sounds terrible. But I drove them up there. Said, okay, let's sit down, and then they have a place to sleep at night. It's very important. And we have other methods as well. There are multiple avenues for financial hardships that we have options for. Some things that we have internally through the county, some things we have through the American Legion funds, other CVIs, other initiatives and stuff like that. But Westcap and the Grace Places have been very, very helpful. And it's always great when you have somebody who comes in who isn't necessarily have a place to stay, that we can send them up that way, and we can even drive them ourselves in some circumstances. So.
And you also, young man, you're not waiting for folks to come in your office door. I know personally a number of vets that are happy because they don't particularly drive, and you take the time to go to their home.
Yep, we can do.
You want to talk a little bit about that too, please?
Sure. Yeah, home visits. We can do home visits. We can do whatever we need to make sure that we either get those signatures or we talk to individuals, because the statutes that we are bound by through the state, they're pretty hefty statutes. They say that we need to do pretty much everything that we can to assist veterans in their benefits, and that includes going to their home or doing whatever we have to do. I know that I personally have no issue going to somebody's home and helping out or asking, because, you know, like you said, transportation is not very easy for some, and we would have I can think of a few that I've gone to their house and said, okay, I need you to sign here and here, and then we'll just take it from there. So home visits as well. Yep.
Anyone else have a question or comment? See, yeah, go ahead, Kara.
Thanks, Mr. Chair. Thanks, Phil, for the presentation. I know from previous conversation with you, you guys do a lot on with a very small staff. So thank you for that. I'm just wondering what you would consider the biggest issue that's facing our veterans in St. Croix County, and you know what the county is doing to address that, or is there more that we can do to help address that?
One of the biggest things right now, specifically being in the pandemic that we're being in, is that financial is not, it's close. Financial and mental health are kind of teetering right on the same, I would say 1A and 1B. And a lot of times they go hand in hand. If somebody is stressed out about money, then they're also going to be stressed out in their personal and mental health lives as well. And that shows. So what can we do? We need to try to get as close to back to normal as we can, to go out and to have normalcy as much as we can. Not, you know, I'm not saying that people should not wear masks. That's not where I'm at. But if we can get over this and then we can start opening things back up, people can start doing a more routine type of thing. That is the biggest thing that I see. Financially, there's been a lot that has actually happened since the pandemic hit, and that's been on the state level, local level, West Cap level, to help people financially. The veteran service organizations, who are fantastic, they have done a lot as well. Now, their revenue streams are down as well because they can't go out and fundraise. So it's a tough situation, but there's a lot of different places that we've sent veterans as well. And they've gotten the help that they need. Mental health, that, like I said, we have multiple options for them, whether it be the St. Paul Vet Center, La Crosse Vet Center, the mental health that we have through the county, through the VA. There's a lot of options as well for that. So I don't know what else the county can truly do. If I've asked for something, I've gotten it. And that's a lot of credit to the leadership and to the board. So I don't know what we can truly do to really improve. So I would love to do more outreach to try to get ourselves out there a little bit more and really reach some people who haven't heard of our services, because once they do hear of our services, they tend to be pretty happy about them. So that would be the biggest thing, but we really can't do that. And we had an outreach event that we had planned, but COVID got that one too. So, but we will open it up again. And when we do, we'll just kind of go from there.
Anyone else have a question, comment? Well, Phil, I want to thank you and Joe and Kathy. Our men and the women who have served us well are very grateful that we've got the three of you helping them out and their families as well. So our hats are off to all three of you. Thank you very much for all your great work.
Thank you very much. You bet. Appreciate the opportunity.
You bet. Okay, we're going to move on. We're almost to the end tonight, folks. We're going to get out of here early. Is there any requests for future agenda items? Don't all rush in at the same time now. All right, seeing none.
Mr. Chair?
Yes, sir.
I was going to propose that it might be helpful if I provided a director's report. It could be as often as you wanted it, but I was thinking quarterly, just to give you a better summary of what we're doing, the kinds of things that we're doing more broadly around the department, if that would be helpful. I could start that whenever you would like me to.
That's a great idea, and we're more than willing to, anytime you want to start, we'll listen.
Well, it may show up on the April agenda then if that's something you would like to.
Okay, put it at the top of your list, young man. Anyone else? Okay, we'll go on to announcements and correspondence. Bob, you want anything there?
Yeah, thank you, Mr. Chair. I did have a couple of announcements I wanted to bring to your attention. And I want to thank Phil for making the time this evening. I know you had some childcare juggling to do to make that possible, so thank you. And of course, to our public health staff and to Faye. I hope you're all going to have a good St. Patrick's Day as well. But the announcements that I had, I wanted to let you know that Children's Services was awarded a grant from DCF for $88,320, and that's related to victims of sex trafficking that are placed in out-of-home placements, in this case, out of state sometimes. We received that grant award amount to offset the costs that were associated with those out-of-home placements. So hats off to Julie and her team for getting that money to help us pay for those kids and their placement. Children's Services was also awarded a 4E legal. It's I don't know if you'd call it a grant. It's funding that in essence goes towards guardian ad litem to help pay for guardian ad litem time, and that money is actually passed through to the courts. So there would be a $17,000 pot of money that would go to the courts related to this award or this funding stream. And just to touch upon the ADRC and public health grant that Faye mentioned earlier, I think what we're anticipating is if we get that money and there's a list of allowable expenses that we can use that money towards, again, it's to help get vaccine to homebound people within that population of the ADRC. And there's a number of things we could use the money for, but I think the base amount was around $8,000, but that could go up if other ADRCs don't apply for this grant money or there's not as much awarded to them. So we could see when that award comes out that we get a little more money to dedicate towards some of these things that would help homebound people either get to a vaccination clinic or get vaccine to them in their homes. That's a joint effort between public health and the ADRC. They work together on that. And the last thing, and I apologize for this, I didn't get information out to you already, but the day at the Capitol this year will be virtual. And the Wisconsin County Association sent out sort of a packet of information about how we can engage on a virtual platform to talk with our legislators. What I need to do is, it's my first year, of course, in Wisconsin, but it's also the first year they're doing this virtually. So there's some coordination that needs to happen. And they're asking, the WCA is asking HHS directors to help coordinate the team of individuals from the county that would want to talk with legislators. The day at the Capitol is on April 13th. There's a WCA presentation that day. And then what I would like to do is talk with Chair Osnes, and I believe Supervisor Fiedler is also on the CAP team for St. Croix County, and Administrator Witt, and see what other kinds of outreach I can do to build a team of the board and other individuals to participate in Day at the Capitol, if that makes sense. Okay. Paulette nodded, so that's a good sign. That was all I had for announcements, Mr. Chair. Thank you.
Well, in your last announcement, Bob, you didn't read your contract well enough, because at the bottom, that's one of those other duties as assigned. You know that, don't you?
Well, I did a lot of advocating and lobbying in the past. I just this process is different to me, so I appreciate any help I can get in navigating it.
And we welcome you with open arms to our CAP team. So thank you for be willing to help us out with that.
Of course.
And thank you for the good news on the grant money too. That's a good way to end up our meeting tonight. Hats off to Julie and everybody else who was at large in making those applications for us. Adam, do you have anything you want to throw in or add us?
Yeah, I have a couple things. In the next week, we're working on some changes to the website, so there will be some updated information on the COVID-19 page. There's been a lot of change in guidance, so we're going to work on updating as much of that information as we can, and just to keep on top of all of the changes, so people can keep coming back to the St. Croix County website and know that they're going to have the most recent information. We are working on the second public health newsletter. We are looking at doing that as a digital newsletter. I'm looking at a year in review, looking back at what the response has been since the beginning of the pandemic, how we responded, how we got here, how we've been doing, and then looking at obviously some updates with the eligibility and availability of vaccines. So we're working on that. I don't have a tentative date yet on when that will be released, but I'm working with public health on those stories. A non-COVID related HHS topic, I've been working with the Adrc on some communications, and today we just published a new survey, their aging plan survey. It's available on the Adrc landing page. We'll be adding a link to that from the homepage of the St. Croix County website and sharing that on social media. That's really to help them gather feedback so they can look at, I believe they're doing a 3-year plan. So the information that they gather during this survey will help them determine what services they need to offer to the populations that they serve.
Any questions for Adam or comment? Adam, I need to thank you, and I need to thank Bob, and as long as Ken is sitting over there in the middle of the screen too, I need to thank all three of you gentlemen. You've been, you guys have always been gracious when I come in and need some help or some answers, or we can bounce some stuff off each other. That time is greatly appreciated. I want to thank all three of you publicly for that. So thank you, guys.
Thank you.
Ken, how about you? You got anything you want to throw at us?
I have no announcements for you, no.
Ooh, we better circle that one in the minutes big time. With that, I've had the opportunity to talk with Bob and Ken. As most of you know, the goal is to try to get everyone back in personally in June. If possible, get everybody back together again, all under one roof. And I think to do that, especially with this group, my recommendation will be starting next month. And Ken and I talked, if it's just him and I across the hall, we're going to try to gradually get everybody back back into the government center if we can by the end of June, if that's possible. If things go south, health-wise and with COVID again, we may have to back off on that, but that's basically our goal. Ken, you want to add on to that at all?
Well, I think the reason we went to full hybrid was because of the large numbers of people that were coming in. You guys became very popular, but your popularity has dropped off significantly. So we had one person in person this evening in the room, and we had 5 online watching. So with those numbers, we should be able to meet at least in the hybrid format where some are in person, and still maintain the social distancing space that we need.
And I know we're not ready for discussion. Has anybody got a comment or anything on that? Or if you do, if you want to send me an email, don't be afraid to do that. We'll get back. But that's our goal right now. There's nobody across the hall, so we need to get back together again, I think. And I thank each one of our members. Dr. McGinnis, you're fantastic. You bring so much to the table. We can't begin to thank you. And all the good work that you're bringing. Deb as well, Natasha. I can go right around the list to our county supervisors as well. So everybody's been very patient. We've all been safe so far. We've been healthy, knock on wood. And I can't begin as chair to thank each and every one of you enough as well. Each of you bring a tremendous amount of information and knowledge to the table, and it is greatly appreciated. And it's nice that we can get that good, positive information out to the general public. So I thank you. And with that, our next meeting will be April 21st at 5 o'clock, for those of you who want to circle it on your calendar. And with that, be safe, be kind to each other, and be patient, and we are adjourned.